Screening's important because the earlier you can catch any cancer, of course, higher chances of survival are. And screening is so much easier than it is for many other diseases. So it takes a few seconds and it can save your life.
We hope you're enjoying our Lung Cancer Foundation of America World Lung Cancer Day social media takeover. It's a chance for us to share hope for people living with lung cancer.
And those people include our veterans who so bravely served our nation. Today, they face a new battle, a heightened risk of lung cancer.
Yeah, this may be because they've been exposed to asbestos, burn pits, and other occupational hazards during their service. And that's exactly why LCFA launched Breath of Honor Lung Cancer Screening for Veterans campaign.
And part of that campaign includes a podcast, a Hope with Answers podcast, that talks about the importance of screening for veterans. And we want you to take a look. Dr. Drew Moghanaki and Jim Pantelas, thank you so much for joining us today. We're thrilled to be having this conversation with you. You know, Dr. Moghanaki, let's start with you. So you are the Chief of Thoracic Oncology at the UCLA Department of Radiation Oncology and the co-director of the VA Lung Precision Oncology Program at the Greater Los Angeles VA Healthcare System. What would you say to our nation's brave veterans who may be hesitant to get screened for lung cancer?
It's a no-brainer to get screened for lung cancer. Get screened because guess what? We've got treatments that can save your life. No one needs to die of lung cancer if we catch it early enough.
Dr. Moghanaki, we mentioned you work with the VA, where there's an estimated, I think, 1.5 million veterans enrolled in VA healthcare that do meet that lung cancer screening criteria. That's a positive. That's a lot of people, though. Is the VA able to reach all those veterans?
Yeah, so of the 9 million veterans who do receive VA healthcare, we do estimate about 1.5 million of them meet the criteria, and we are trying our best to screen them. It used to be difficult for VA to provide timely care to all of the veterans for a variety of reasons, not just volume, but also a lot of our veterans live really kind of in faraway places and there's scheduling challenges. But today, you can go online and see this. Congress has authorized appropriations for VA to purchase care in the community whenever it can't meet its needs. So at this point, I don't see any reason why, the VA under its congressional authorizations can't screen all of these veterans. We just got to reach them and find them and get them screened.
Jim, you're a Navy veteran and a 18-year now, right? Lung cancer survivor.
Yes.
I'm interested in your story and what kind of message you have to the veterans out there about finding out, whether or not they're eligible to be screened and finding out whether or not it's worth it for them to have this screening. What do you think?
I was diagnosed with a non-small cell lung cancer and I was a heavy smoker for many years, but had quit before I was diagnosed. I had quit a couple of years before I was diagnosed. But the reality is that I was also exposed to asbestos while I was in the service. I live in a part of the country that has higher than average rates of radon. What I would tell vets is that if you're breathing, you can get lung cancer, right? If you increase the odds of getting lung cancer, which smoking does, then you should be screened. But because you were in the service, you were exposed to toxins. Because you were in the service, you were exposed to living in different parts of the country or the world that may have had toxins that you're not aware of. Getting screened is a no-brainer.